Did you know diabetes is one of the most common chronic health conditions in Georgia? Hi, I'm Mike Nichols with Cobb Senior Services, retired senior volunteer program. November is National Diabetes Month, and we want to share some important information with you. There are approximately 30 million adults aged 18 years or older in the U.S. living with diabetes and 84 million with prediabetes. Diabetes Awareness Month highlights the everyday reality of living with this disease and those affected by it. We've pulled together a panel of authorities to talk with you about what life is like with diabetes and what you can do to manage it and reduce your risks of getting it. Our panel includes Kathy Berkowitz, Jobsy Alexander, Vivian Denman Willis, and in a moment, each of our panelists will give you a brief introduction on this important topic and then answer some questions submitted to them. Now let's get started with introductions from our panelists.
My name is Vivian Denman Willis, also known as Bunny, and I have diabetes. I also have a husband with congestive heart failure, my 88-year-old mom with increasing confusion and memory issues, who lives with us and has high blood pressure too, and two spoiled doggies with special needs. In living with diabetes, I've discovered changes in blood sugar can significantly impact your life and the lives of those around you. Of course, every diabetic has a different set of circumstances, but each of us must acknowledge our situation and incorporate individual life experiences into their diabetes management and self-care strategies. I have, with challenges, but it's an ongoing process. I appreciate the opportunity today to share a portion of my own diabetes story with you. Thank you.
Hello, my name is Kathy Berkowitz, a retired nurse practitioner and diabetes care and education specialist. I currently volunteer with Cobb Senior Services Retired Senior Volunteer Program. As Mike just mentioned, diabetes is a chronic, common health condition with potentially serious consequences. Almost 1 in 4 adults over the age of 65 have diabetes. While diabetes can seem overwhelming and challenging at times, I encourage you to look for the information and support you need from your healthcare team, family, friends, and your community. For example, Cobb Senior Services. The good thing is you can live a full and healthy life with diabetes.
Hello, my name is Jobsy Alexander, and I am the Nutrition Manager and Registered Dietitian for Cobb County Senior Services. We know from many studies, healthy eating and exercise is very important to controlling your blood sugar. For many people living with diabetes and those who are trying to prevent type 2 diabetes, some small modifications can assist you with controlling blood sugar, preventing and or delaying the onset of type 2 diabetes. Some recommendations I would make is if you are able to lose a moderate amount of body weight, I would say about 10% of your current body weight. Stay physically active by walking 30 minutes a day and also help make healthy choices when it comes to your food consumption.
Many people refer to diabetes as having a little sugar or sugar diabetes. This comes from the medical definition for diabetes, which is the presence of high levels of glucose, which is the type of sugar in the blood. High blood glucose or sugar levels damage our small and large blood vessels and nerves, which can lead to serious health problems. That's why it's so important to detect and treat diabetes early before any damage can be done. Scientists have been working hard to find a cure for many years and continue their work today. Their discoveries have led to many advances in the way we care for diabetes. While there is no cure yet, a better understanding of the disease, the development of new medications, and new technology have reduced the burden of living with diabetes. Having so many medications to treat diabetes can be confusing. People with type 1 diabetes don't make any of their own insulin and require insulin injections. Type 2 diabetes, the most common type of diabetes, is a progressive disease. The body may make less insulin over time and may require insulin injections. People with type 2 diabetes have a number of reasons other than reduced levels of insulin that can cause blood glucose or blood sugar levels to be too high. Different types of medicines work in different ways to lower blood sugar levels, so more than one medication is often needed to lower blood sugar levels. There are now over 10 different types of diabetes medications or 10 different classes of diabetes medications to control blood sugar, which is good news for people with diabetes. Don't be afraid to work with your healthcare provider to try different combinations of medications to see what works best for you. And remember, diabetes medications are not a replacement for a healthy lifestyle. You still need to continue with healthy eating and physical activity. Diabetes often occurs in combination with other health conditions such as heart disease, high blood pressure, kidney disease, and stroke. This is because of the damage to blood vessels caused by high blood glucose and blood pressure. This is an especially important issue right now because of COVID-19. People with diabetes are considered at high risk and have been warned to carefully follow all of the public health recommendations to prevent the virus. Doctors have found that people with diabetes are at high risk for serious complications from the virus, especially if their diabetes is poorly managed.
This year has been so different, but the COVID-19 numbers and certain factors seem to be stacked against me. A senior citizen, an overweight woman of color, and caretaker too, all lead to heightened anxiety. I hear in the news about seniors with pre-existing conditions like diabetes are at a high risk for COVID. So I had to take what I thought were necessary steps to reduce the risk. For example, I actually have my own thermometer that I'm able to take readings. Green means I'm okay, but it also means that my family are okay and any outsider who happens to come into my environment. It's all a matter of staying safe. I also have other technical items like you see that? This is UVC to clean my glasses, my phone, which is very dirty all the time, very germy, my glasses, and other objects. Even when you go out to a restaurant to actually do your forks and your table or your surrounding environment there. I try to stay safe, sanitized, and sane with portable equipment. Also, the equipment that might include your gloves, masks, shields, antibacterial wipes, the sprays, the soap. Oh, it goes on and on. And trust me, some of my family members, some of my family members think that I've been a bit OCD. Everyone's experience is a little bit different, but acceptance of the diagnosis in order to take action has to be at the top for me. You know, this isn't an overnight disease. So doubting new doctors' diagnosis came second nature to me. Annual checkups before had never even indicated a diabetes diagnosis. It was over 6 months before starting my medications. And the anxiety, well, just think of it. I pictured my own diabetic uncle and possibly even my grandfather. Both had diabetes and had amputated legs. So that was pretty hard to come to grips with. But coming to grips with my new reality actually is what kick-started me onto my diabetes management journey. I proactively work to achieve a positive lifestyle at home and in the community. I've calmed much of my anxiety, anger, and depression by learning more about diabetes. I've incorporated a variety of positive activities into my daily life, and I'm blessed by more opportunities as time goes on, both spiritual, social, mental, and physical strengthening. Now, I've actually started a Red Striders project. It's a fundraiser called Dance for Diabetes Cure. It's a challenge, and that helps me. I've learned also better eating habits and discovered, due to personal preferences or just previously unknown, new foods to introduce to my diet, like beans or quinoa, still cut oats, salmon, green leafy vegetables, and lots of water. Of course, there are a lot of alternatives for those who don't like to drink a lot of water, like hot green tea or some of the flavorings that you can add to water.
The holidays do create a lot of anxiety for people with diabetes because this is a time where they get to socialize with their family members and see friends and probably enjoy some of the family recipes that's been in their family for a while. Food is a cultural connection that we share with our loved ones, and it is okay to indulge at times. People with diabetes will start to feel a little left out because they cannot have all the desserts and everything that's on the table. One of the recommendations I have to make is to plan ahead. Plan what you are going to eat. If you know the family gathering that you're going to is not going to have a salad or anything that is low carb, make sure that you bring something so everybody can share that. And try to plan which meals you're going to consume. Don't overwhelm yourself by thinking about what you cannot have, but focus on what you can have and know your limits. And also, when you are putting food on your plate, think about the low carb food first. Include a half the plate with high whole grains, as well as include food that are lower in carbs, and then focus on lean proteins, as well as including the high carb casserole that you may like that your aunt is used to making. You want to make sure, even though it's a holiday season, after you eat, try to stay active. That will help you with controlling your diabetes and your blood sugar. So just after your meal, go for a walk, stay active a little bit. Maybe this is something that you can do as a family to make sure that you are staying physically active. Everybody has different needs. Weight loss is one of the most natural ways to prevent or manage type 2 diabetes. People who have diabetes have too much sugar in their blood, and this happens because of the problem with a hormone called insulin. Insulin is made in our pancreas, and as we get older, we may not produce the right amount of insulin we need on a daily basis. When you eat, the pancreas releases insulin into your bloodstream. Insulin allows sugar to enter your cells. If you have type 2 diabetes, the pancreas does not make enough insulin, or your body cannot use the insulin that as it should. So the sugar cannot move into your cells. Instead, it stays in your blood and build up in your blood. So that's why you end up with high blood sugar. Weight loss reduces many of these problems. When you weigh less, your pancreas is better able to keep up with your body's need for insulin. In some cases, weight loss is enough to restore the blood sugar to a normal level. If you lose, like I was saying earlier, about 10% of your body weight, a lot of times that's when you're pre-diabetic. You don't have to go on medicine because your body can correct itself. Absolutely not. Having diabetes does not mean you have to start eating everything that you like. It is important to focus on portion control and your carbohydrate and sugar intake, but it is very important to include high fiber foods as well. You can still engage in holiday meals and eat the food that you're used to eating during the holidays, but however, monitor what you're eating and check your blood sugar if you're on insulin to adjust your insulin as needed.
It is manageable. My diabetes is manageable with proper assessment of symptoms. Diabetes management and self-care can be tailored to reduce the risk of medical issues, and it is life-changing. I've accepted my progressively changing health situation and its impact on relationships, multiple responsibilities, and taking care of myself. That's a positive outlook now, and also taking that into the future. Also, I found respite in my faith, family, and friends. Seeking and giving services to my community is a blessing, and choosing to take a break is invaluable. I guess to sum it up, you have to remember that everyone is different, and it's ultimately up to each person to find how and what your body responds to. Be aware, do your own due diligence, and live your best life.
What I'd like to remind everyone is that diabetes is manageable. Don't be afraid to seek out the help and support you need. You're not alone in this journey.
Lifestyle changes can be hard and it will take continued motivation and time. Focus on smaller changes and pick yourself up if you made an unwise choice. If you cannot start with 30 minutes of exercise, start with 10 minutes and build yourself up to 30 minutes. If you're used to eating dessert every day, maybe cut that back to 3 times a week instead of every day. Include your family or friends in your process so that way you can stay motivated and continue to succeed.